to find an NHS dentist for his 19-month-old child, even at the 7th time of trying. My right honourable friend well understands the crisis he's inherited. Will he meet with me to discuss the shortage of dentistry in Stockton North and across Teesside?
Mr Speaker, I'm just so sorry to his constituents and so many others who are dealing with the consequences of the Conservatives' failure on dentistry, and I'd be delighted to meet with my honourable friends to discuss the challenges in his area.
Shadow Secretary of State Victoria Atkins.
Thank you, Mr Speaker, and may I congratulate all nominees and winners in the NHS Parliamentary Awards yesterday. They were richly deserved, and I think it was a very good example of the House coming together to celebrate those who work so hard in our health service and social care services. In the last 5 weeks, I have asked the right honourable gentleman 29 questions at this dispatch box, yet he's managed to answer only one. For the rest, he's tried to bluster his way out of his own policy decisions, as indeed we've seen this morning. So let's try again. Which is the first week that his promised 40,000 more appointments will be delivered?
Thursday.
I mean, after the performance I had to put up with when she was at this dispatch box, she's got some brass neck turning up at that dispatch box complaining that I'm not answering her questions. She will know that we are working at pace to stand up 40,000 more appointments every week as our first step, as promised in our manifesto, and we will deliver. And more than that, we will go into the next election with a record that she could only dream of.
Victoria Atkins.
So, after 14 years of opposition, 2.5 years of which he's been sitting on these benches, travelling around the world, funded by other governments to look at their healthcare systems, and over 100 days in this government, he doesn't even know the start date of his own flagship policy. He's no action man, Mr Speaker, he's anchor man. But let's deal with Labour's cruel decision. After Labour's cruel decision to slash winter fuel payments, which will add pressure not only to patients but also to the NHS. The NHS's Deputy Operating Officer.
Please, I've got a lot of people to get in. They've got to be short from both front benches. Victoria.
After Labour's cruel decision to slash winter fuel payments, which will add pressure to the NHS's Deputy Operating Officer has warned that this winter our health service won't have the extra capacity or funding needed and which had been provided previously by the Conservatives. Why has the Secretary of State...
No! Please. I did give you a hint to come to an end, not to carry on fully. That is... No, it's not fair. It's unfair to both of the backbenches that I'm trying to represent. I want a short answer back.
Mr Speaker, she questions the budget for this winter. It was a budget set by her government. So is this finally an admission of failure on the part of the Shadow Secretary of State? And I'll tell her something else we'll have this winter that we didn't have last winter or the winter before, and that's no...
Lila McAvoy.
Can the Secretary of State meet with me to discuss a cross-departmental pilot in my constituency of Darlington, bringing together the DWP, education and health to tackle some of the immediate pressures facing CAMHS and mental health services in my area, the impact these are having on schooling, the local workforce and family outcomes?
Minister.
I thank her for that question. By cutting mental health waiting lists and intervening earlier, we can get this country back to health and back to work. 2.9 million people economically inactive, a large proportion due to mental health issues. Many people can be helped back into work through talking therapies, and we're going to be putting a mental health professional in every school, rolling out 8,500 specialists, and I'd be happy to meet with my honourable friend to discuss further.
Person Helen Morgan.
Speaker, 4.4 million children in England haven't seen a dentist for at least a year. Meanwhile, in Shropshire, Telford and Wrekin ICB, £1 million of dental funding went unspent in 22-23. The system's clearly broken. When can we expect him to fix it?
Mr Speaker, it is precisely because of the situation she describes, both the poor services and also, ironically, the underspend in the dentistry budget, that we'll be working not only to stand up the 700,000 urgent and emergency dentistry appointments we promised, but also to do the prevention work for children in our schools.
Manjit Singh Desi.
Speaker, many in my constituency are very, very grateful that Slough will soon be home to a £25 million community diagnostic centre, which will help to reduce waiting lists. But many are also concerned that the local trust may be contracting out services for MRI scans. Does the Secretary of State share my concerns that instead of just outsourcing, local trust should, wherever possible, try to increase expertise and capacity in-house?
We are committed to expanding community diagnostic capacity to build an NHS fit for future. We are clear, however, that independent sector providers have a role to play in supporting the NHS as trusted partners to recover elective services.
Stevenson.
Thank you, Mr. Speaker. I welcome all efforts to increase the number of GPs throughout England. Residents in new and growing towns like Wixham's in mid-Bedfordshire need a GP surgery, and my local councils have been told that they need to put up the capital to deliver one, causing concern over cash flow and borrowing costs. Will the Minister meet with me to discuss a new capital investment programme to ensure that residents in new towns like Wixham's don't have to wait for developer contributions to get the services they need?
As Lord Darcy outlined, capital development in the NHS is shocking. It's behind £11 billion worth of backlog. I'm very happy to meet with him about his particular problem.
Ruth Jones.
Thank you, Mr. Speaker. Alan Peterson is a senior pharmacist in my constituency, and he tells me pharmacies have seen high volatility in drug pricing and big increases in bills in recent years, and at the same time they're expected to do far more in direct consultation with the public. So given the UK's government's jurisdiction over the funding of dispensing services across England and Wales, can the Minister tell me when the government plans to review pharmacy funding?
I thank you for that question. Obviously, health is a devolved matter, and the funding for pharmacies in Wales is the responsibility of the Welsh Government. Nevertheless, I pay tribute to the Welsh Government for securing a deal with pharmacies in Wales in line with the DDRB pay recommendations. I know arrangements in England also affect pharmacies in Wales, and I'm working as a matter of urgency to conclude the consultation on community pharmacy contractual framework.
The Tobacco and Vapes Bill actually went through its committee stage at the last Parliament, to correct the Secretary of State for Health. At that stage, a number of amendments were proposed across the chamber. The then Minister, Andrea Leadsom, agreed to take those amendments away and bring them back. When he brings back the bill, will he incorporate those amendments so we strengthen the bill?
Secretary of State.
Whatever stage it got to, Mr. Speaker, it wasn't completed, was it? We will bring back a tobacco and vapes bill which is stronger than the Conservative Party, and I look forward to seeing if they support it.
Rebecca Long-Bailey.
In the city of Salford and was temporarily closed in 2022 amid an acute midwifery staffing deficit across Greater Manchester. So would the Secretary be kind enough to meet with me to discuss what he can do to ensure that this unit opens safely as soon as possible?
Minister.
She's right to raise the crisis of midwifery services. We've already had debates in Westminster Hall about this. It's an issue that affects the entire country. It is a priority for this government, and I'm, of course, happy to meet with her to discuss her constituency issue.
Ollie Glover.
Thank you, Mr. Speaker. Lord Darcy's report highlighted the importance of local focus and alignment to coordinating local services and improving health, contributing to reduced hospital admissions. In Oxfordshire, the Integrated Care Board is proposing to remove Oxfordshire's dedicated place director. Will the Minister give his support to place-based roles to maintain local authority alignment as recommended in Lord Darcy's report?
Minister.
Mr. Speaker, I absolutely take the point the honourable gentleman's making about the importance of place-based leadership. That's why one of the things we'll be looking to do as part of the 10-year plan process is to clarify roles and responsibilities within different parts of the system to make sure we've got better strategic place-based leadership.
Thank you, Mr. Speaker. Mr. Speaker, the Royal Stoke Hospital is leading the way when it comes to treatment for stroke patients, but like so many illnesses, prevention is better than cure. So could the Secretary of State set out what this government is doing to minimise the number of people affected by these life-altering events?
I agree with my honourable friend. That's why we've set a goal for fewer lives being lost to cardiovascular disease. We're going to make it easier for people to have checks in the comfort of their own homes through things like the digital NHS health check and through the new workplace trials.
Jerome Bayu.
Labour's cut to the winter fuel payment will cause 262,000 coal pensioners to seek NHS treatment, according to the End Fuel Poverty Coalition. Does the government agree with those figures, and if not, what are their own estimates?
Minister.
Mr Speaker, the decision on winter fuel allowance is not one that the government took lightly, but we inherited a £22 billion hole in the nation's finances. We continue to stand behind vulnerable households, increasing the state pension with the triple lock, delivering the Warms Homes discount, and to extend the household support fund to support the most vulnerable pensioners.
Pension is the most important intervention to improve health outcomes, and yet since 2015 the public health grant has fallen in value by 25%, 30%